تمام. I'm trying to finish the second lecture of antimicrobials. Let's start with the glycopeptides. I think we went through them. We talked about vancomycin and teicoplanin. We mentioned how they are restricted to gram-positives as they are unable to penetrate the outer membrane of the gram-negatives. كتير مستخدمهم على gram-positives that have multiple resistance to other drugs, غالبا المرسى. They are again much like other cell wall targeting antimicrobials. They are bactericidal. They block transpeptidization by mechanism different. حكينا this is the vancomycin binds directly to the D-alanine portion of the pentapeptide, which blocks the transpeptidase from binding. Whereas with the beta-lactams حكينا they bind to the transpeptidase itself. So they bind the actual D-alanine portion. So it doesn't matter how you change your peptide, your enzyme, your penicillin binding protein, you still are unable to bind to the D-alanine because vancomycin binds it and change its shape. أنواع أخرى في عندنا fosfomycin. This is a simple drug usually used for UTI. Resistance rises quickly for this medication. Bacitracin اللي بيستخدم أكيد شفتوا bacitracin إذا كلكم عندكم أتوقع bacitracin اللي هو اللي بيستخدم أكثر من الأدوية تستخدم as a for بالكريمات الأنتيبكتيريا. So antibacterial creams usually contain bacitracin. It's too toxic for systemic use, that's why it's only used for creams, and we use it لما نحكي كمان قدام we use it to identify hemolytic group A hemolytic streptococci. So it can be used the bacitracin resistance versus sensitivity. إنه مثلا the sensitive would be the alpha hemolytics would be sensitive to bacitracin, whereas all these in the beta hemolytic, between the group A and non-group A. Group A would be sensitive to bacitracin, and other beta hemolytics would be resistant to it. Isoniazid and some other compounds that we use. Isoniazid is a interferes with the formation of the lipid-rich cell wall of the mycobacteria, so the mycolic acid basically. So this is usually an anti-tuberculosis drug. وفي cycloserine is a D-alanine analog. كمان يستخدم in certain resistant strain of TB. So حكينا this is another. I think I like this picture. So we have the ones that attack the membrane. These are the polymyxins. حكينا عن البيتا لاكتامز already, penicillins, the cephalosporins. حكينا عن المونوباكتيريم اسينام and the carbapenem. هذول بيشتغلوا هنا. vancomycin bacitracin as well. هلا في عند البروتين synthesis إشي بيشتغل على 50S subunit، إشي بيشتغل على 30S subunit. So عادة you can memorize this as TAG, TAG, tag اللي هو tetracycline aminoglycosides work on the subunit and the 30S subunit. Well, 50S subunit is the macrolides, erythromycin, linezolid, clindamycin, chloramphenicol, and cephalogram. وبعدين نحكي عن nucleic acid هو folate synthesis اللي نحكي عن sulfonides. The quinones بيشتغلوا على الجايريز and the polymerase بيشتغل عليهم RNA polymerase rifampin. So that's basically it's a good one to. هلا نحكي عن الأشياء اللي بيشتغلوا على البكتيريال protein synthesis. So ribosomes حكينا they are sufficiently different. It's a good selective target. So most agents here act at this level are true antibiotics and not synthetic. يعني synthetic عادة يستخدموا are derivatives of the Streptomyces species. عادة هم كتير دوروا بالسويل. يعني في قصة بحكيها عادة للطلابي. كان في أحد بجامعتنا كنا بنشتغل في أحد المختبرات واحد من الطلاب يعني he was little careless كنا دائما نحاول نساعده but he was just not up to the task. فبدوروا بالsoil, they keep looking in soil for different compounds, وطلعوا هالcompounds بدوروا so they found an amazing antibiotic, ودوروا طلعوا structure تبعه وكان شيء كتير موجود, but he never did his proper work and he never saved the actual soil. فما عرفوا من وين جابها, فضلوا يدوروا عليها أشهر ما قدروا يلاقوا source of that really good antibiotic that they found, and it was lost. This is actually how they do a lot of these looking. دوروا بالsoil, دوروا different organisms and different compounds, and they keep looking for antimicrobials here. So these protein synthesis inhibitors are usually of this brand. Side effects, they resemble because of the small resemblance between the bacterial ribosomes and the mitochondrial ribosomes. هاي نقطة تانية بدي أعيدها مرة تانية. Mitochondria themselves are the same size as the bacteria. They have their own DNA and they have their own ribosomes. فعشان هيك الناس كتير بيحكوا إنه our own mitochondria actually are actually derived from prokaryotes, from bacteria. So we have bacteria in all our cells have mitochondria in them. So as our cells divide, the mitochondria also divide as well. فلهم their own ribosomes, their own DNA, their own. So our side effects would be affecting this cellular structure اللي هم على الميتوكوندريا أكثر شيء. So mitochondrial DNA, our ribosomes are 55S, 28 and 39, whereas the bacteria, you know, it is 70S, between 50 and 30. فالتاج بيشتغلوا هنا tetracyclines, decyl cyclines رح نحكي عنهم, aminoglycosides, erythromycin, chloramphenicol, all those work here as well. So أنا نفس الشيء side effects here, the same side effects for the same drugs. فهاي يعني بس تذكير لكم اللي بده يتذكر how do ribosomes work. So you have how the tRNA works, how the each shape, how the amino acid sequence keeps increasing here in size at the P side. هو بيدخلوا من هون من A P E وهكذا ضلك ماشي, and this transfer RNA that keeps binding and bringing in new amino acids. تمام, فخلينا نبلش نحكي هلا. So the 30S subunit ones are the aminoglycosides and the tetracyclines. إذا بنطلع all of them are bacteriostatic. كلهم static. ليش static? Because you are preventing protein translation. متى ما راح الدرug translation was resumed. So a lot of them are actually static. في بعضهم بيحكي لك يعني بدك تفكر في كلهم are static, أو بتضيف إضافة بصير cidal. The main one that is only bactericidal is aminoglycosides, and because aminoglycosides have a secondary function على cell wall, على membrane, because of that it becomes bactericidal. Otherwise it is only bacteriostatic. الchloramphenicol and citrogramins really هدول بيحكوا both. That depends on the organism. فبعض الorganisms they die, بعض الorganisms are static, but عشان هيك it's يعني the main one is that is a bacteriostatic. فكيف بيشتغلوا؟ tetracyclines, you can remember the T in the tetracycline that blocks the tRNA binding to the ribosome. عشان هيك حطيت لك هاي الصورة. So if the transfer RNA wants to bind the ribosome, this is where your tetracyclines would work. Translocation, erythromycin and macrolides. So the translocation again in the same one, you're translocating from one to another. From one amino acid you want to translocate it and bind it to the next amino acid. That's for macrolides. Peptidyl which catalyzes the reaction of this amino acids to, binding an amino acid to another. هلا بنرجع لهاي. Aminoglycosides, the functioning, the initiation complex, it blocks this and causes misreading of the mRNA. Other important ones, linezolid, early step in ribosome formation. خلينا نروح هنا. So chloramphenicol here. So the formation of the peptidyl transferase bond. الماكرولايدز وين الماركر عفوا macrolides, they bind to the 50 S ribosomal RNA and prevent the movement of these peptides along يعني بنتقل من هنا. So you want the transfer RNA to keep moving alongside the mRNA, فبوقف هالحكي هذا كله. tetracycline interface with the tRNA anti-codon reading. مش عندك codon اللي هو على الانتي-codon that reads these 3 nucleotides bases that reads the codon. نتذكر حكينا بالgenetics. So this codon anti-codon reading would be prevented by tetracyclines. And the streptomycin would change the shape of the 30S RNA, causes in reading to become incorrect and be error prone. فهلا بلش نحكي tetracyclines. The main one in tetracycline is called doxycycline. إذا بدكم تذكروا معلومة واحدة عن tetracyclines و doxycyclines is that we use them against irregular bugs. إيش هم irregular bugs؟ intracellulars, weird shapes اللي هم مثلا spirochetes, vibrio, so like helicobacter مثلا ممكن تستخدم عليها, chlamydia, rickettsia, هذول intracellulars, mycoplasma اللي ما لها cell wall. So all the ones that have weird shapes and weird اللي كل هذول ما you can't stain with the stain of gram stain. فthat's بسموهم doxy sensitive organisms. Has a good activity against malaria parasites because these are single cell parasites. In addition to the above بيشتغلوا على كل gram positives gram negatives, but we don't use them. They can reach all intracellular organisms. هذا هو الشيء كتير يعني حلو لهم. But عادة we reserve them for these kind of, for the chlamydia, for the rickettsia, for the ممكن helicobacter, mycoplasma, borrelia, مثلا these weird and difficult organisms. كيف بيشتغلوا؟ حكينا they work on the tRNA transfer to the ribosome, so it's a bacteriostatic one. Similar to penicillins, there are many members of the tetracycline group, and they have a differing in pharmacological behavior. Most common one is doxycycline and minocycline. Doxycycline كتير يستخدم. Due to the rising resistance, the effectiveness is being reduced, and that's why we maintain their use for rickettsia, chlamydia, spirochetes, and mycoplasma. Side effects إلهم they have low toxicity in human cells. بس مشكلتهم إنه they have a very high broad spectrum activity. They will destroy a lot of cells in your body, all bacteria cells. فراح يأثروا على الفلورا تبعت الجت، راح يأثروا على الفلورا تبعت respiratory tract، حتى السكين ممكن واحد يطلع له راشز من وراء استخدامه. So you will have diarrhea, you have overgrowth of the bacteria that are resistant to doxycycline in the gastrointestinal tract. The vagina also has its own microbiome, and it will suppress lactobacillus. Lactobacillus إذا بتزيحه ومين بيجي بحله بيجوا اليست هم الكانديدا, and they will have an infection. So this is the main side effect. Other than that كتير بخاف ما بستخدمه بالأطفال for its effect on staining the teeth. مع إنه في ناس بيحكي لك لا إذا كان إشي خطير مثلا borrelia or something very difficult or brucella لا استخدمه because the staining is not يعني ممكن ما يكون عند كل الأطفال, and saving the life is better. Tetracycline هذا بدنا نضيفه, it's a derivative of tetracycline. هدول هم glycylcyclines بنحطهم مع 30S subunit as well. And this is our next one. هلا مع السيفتارولين والvancomycin we add tetracycline in our repertoire of drugs that we use against MRSA and vancomycin resistant enterococci. So this is a very good drug. It means used against resistant bacteria احنا بنخبيه كتير، ما بنطلعه الا للحاجه، and has a lot of activity against other bacteria resistant to tetracyclines. فما بنستخدمه في complicated skin intra-abdominal community acquired pneumonia، فزي ما حكينا MRSA VRE and sometimes even anaerobes. So tetracycline يعني فكروا فيه ان السوبر tetracycline هذا بنخبيه، هم glycylcycline هذا بنخبيه للاشياء resistant. So community acquired pneumonia, strep, hemophilus, legionella. Okay, that's fine. So that's our first one. خلصناهم اللي هم tetracyclines, and these tetracycline by viruses organisms caused by various facultative and anaerobic bacteria عادة نفس ال adverse effect زي tetracyclines. هذا كلورامفينيكول. كلورامفينيكول أنا بوصفه للطلاب، فكر فيها زي كأنه كلور، تستخدم كلور. So it's going to be extremely يعني hazardous to use, and it's very has a very high side effects. بس ما بنستخدمه إلا إذا كان عندنا rare and maybe even يعني very difficult to treat infections. مثلا brain abscess. Someone with brain abscess, you want something that has a very broad antibacterial spectrum. يعني لأنه كتير زي كان بيحكي كلورين, it's almost it can target a lot of bacteria. It acts by زي ما حكينا elongation. It blocks elongation of the peptide chain by blocking peptide transferase زي ما حكينا. And this action happens on the 50S subunit حكينا. It's not part of T or AG tag, فهم everything else will be 50S. So it causes a rare and can be fatal side effect, aplastic anemia, bone marrow suppression, because of their action on the 50S subunit. So we have to transferase ourselves, so it is dose dependent. We can block the production of proteins in our cells and stop all our cells from making red blood cells or white blood cells. So you have complete bone marrow suppression and aplastic anemia. And that's what they call gray baby syndrome. So because of this, the use of this drug, so it is used with caution in certain situations. مثلا زي ما حكينا brain abscess, and functions because of its function on the three most common encountered organisms زي meningitis اللي هم Neisseria meningitis, Haemophilus influenza, and Streptococcus pneumonia. You can use it in very difficult cases of meningitis. Children with petechial rash and مثلا pericard treatment مثلا إذا تخاف أنت مثلا Rocky Mountain spotted fever, rickettsia, or meningococcus, they can be given at that time. هاي هي gray baby syndrome. So bone marrow suppression toxicity due to the using of chloramphenicol. So meningitis, very severe case of meningitis, rickettsia, or brain abscess. هلا aminoglycosides, probably the largest group of the protein targeting antimicrobials, and probably one of the most common uses. هلا أول شيء نتذكره النقطة اللي حكيناها قبل هيك إنه they have a synergistic activity with the cell wall اللي هم البنسلينز والسيفالوسبورينز. إذا نتذكر حكينا they are bactericidal and they target the 30S subunit. Inhibiting the formation of ribosomal initiation حكينا, but they also cause misreading of messenger RNA. The theory is that the misreading causes mutant proteins which incorporate in the cell membrane, causes fissures in the cell membrane. هيك بصير bacteriostatic, over time becomes bactericidal. Because of their activity on the cell membrane plus the cell membrane affecting penicillins مع بعض بصير they have an exaggerated effect which is called a synergistic effect لما نستخدمهم مع بعض. So the first of the aminoglycosides هم streptomycin كان استخدم كمان discovered in random soil sampling, and the group of antibodies predominantly active against enterobacteria and tuberculosis. فهذا هسه نضيف عندنا isoniazid, عندنا linezolid حكيناهم, rifamycins, and now streptomycin. هذولا our anti-tuberculosis drugs. Um, some such as gentamicin. Gentamicin is one of the most commonly used aminoglycosides. مع tobramycin, they have activity against Pseudomonas. So now our own cyanotacricillin, piperacillin, ceftazidime, حكينا استريونام, and now we have genta and tobramycin. These are now هل جمعنا شوية drugs for the Pseudomonas. So gentamicin, tobramycin, other members of the family have no use against gram-positive streptococci or certain anaerobes, ولهم intracellular اللي بنستخدم لهم الدوكسيسايكلين. The group also has common side effects كتير تذكروها دائما: auditory, kidney, ototoxicity, nephrotoxicity, auto-nephro هدول هم this is the common side effects of aminoglycosides. نقطة ثانية, there is no oral preparation, we do not use it orally at all. هذا كله يستخدم بالمستشفى, ما حدا بياخذ, ما حد بيعطيه جنتامايسين بروحوا على البيت, only be given IV. عشان هيك في واحد من انواع الامينوجلايكوسايدز اسمه نيومايسين هلا اغلبهم لهم 10% 20% absorption, so it's not good for oral preparation. Neomycin has almost 99% no absorption او اقل, so it stays in the bowel, فمستخدمه and it kills all the bacteria and a lot of the gram negatives in the gut, and that's what people use to prepare إذا بدك تعمل surgery على البowel. So you can give them neomycin and you can kill all the bacteria and reduce the bacteria in the gut, so you can do surgery. Aminoglycosides have been used commonly to make a great combination. حكينا هذا مع البيتا lactams, so they are synergistic with beta lactams. حكينا إذا بدك empirical treatment مثلا sepsis or immunocompromised patient or someone that you don't know what they have, this is the why we use it, because you can cover a lot of it would have a large broad spectrum activity. They can penetrate the gram-positive cell wall, thus we don't use them on the gram-negatives by themselves. مساعدة لما تستخدمهم مع penicillins, they will have an exaggerated, also still a synergistic effect on gram-positives as well. الريزيستنس عالي كتير لهم, يعني ترتفع كتير. resistant to these drugs come in the form of تشغل أو عفوا بتغير شكل أو change the structure of the ribosome itself. So you can also alter the intake of the drug or the uptake of the drug. So both these mechanisms, يا تغير ribosome or reduce the uptake of the drug, you can reduce its activity. Most commonly, it is usually عادة due to the third mechanism, which is the production of bacterial enzymes, which لأنهم بما أنهم proteins from or compounds from other microorganisms, so you can modify them and modify the exposed targets لأنهم بتغير شكلهم and they will not be able to work. هلا زي ما حكينا tigecycline is the super tetracycline, amikacin is the super aminoglycoside. So this is one of the drugs that we use for high resistant organisms, so it's resistant to most of these common enzymes, so عشان هيك نقدر نستخدمه a lot of the last saline drug that was used for the last line of defense. فبنجمعهم هذا مع الكاربابينمز مع الفانكوميسins مع التيجيسايكلين, so these are our resistant pathogens. هلا amikacin احنا again it's still aminoglycoside, فما بنستخدم على gram positives. This is something more towards the gram negatives enteric bacteria. So amikacin هيو نستخدمه ضد السودوموناس, tuberculosis, بنقدر نستخدمه again these are the properties, and all of them again you will use for the gram negatives. مش حاطين gram negatives because all of them are positive for the gram negatives اللي هم gram negative enterics, but the specialty اللي هم pseudomonas والTB موجودة. Gentamicin, tobramycin are good against pseudomonas, but both don't work against TB. Neomycin ما بيشتغل على ولا إشي, it's not absorbed. And yeah, the streptomycin, really streptomycin and kanamycin are the ones for TB. So kanamycin, streptomycin for TB, gentamicin, tobramycin for pseudomonas, amikacin for both because it's the super aminoglycoside. Ototoxicity, obviously the one that has poor absorption will have the highest toxicity, and the first one that is ever used, the streptomycin, has the highest ototoxicity. Nephrotoxicity, really all of them have nephrotoxicity at varying degrees, but maybe streptomycin was a bit less. So streptomycin, tuberculosis بنستخدمه. gentamicin, tobramycin ما حكينا against all the gram-negative rods, including زي ما حكينا pseudomonas, amikacin as gentamicin and tobramycin, and neomycin is the preparation for the bowel. هنا autotoxic, nephrotoxic, most widely used هم gentamicin, tobramycin, effective for the resistant organism هذا هو الاميكيسين, and too toxic to use, this is the neomycin. هلا بدنا نحكي عن الماكرولايدز. macrolides بجوز سمعت عن بجوز the most famous macrolide اللي هو erythromycin. Macrolide antibiotics are named so because they have a large macrocyclic lactone ring. They interfere with the translocation of mRNA زي ما حكينا. They are bacteriostatic at normal the regular used doses, and the higher doses can become bactericidal. They are mainly used against gram-positives, so we use them against the staph and strep of the bacteria. So if احنا قاعدين نحكي عن the protein ones, so these are probably the first ones that we use against proteins that we use for يعني عادة أكثر على the gram-positives. So far we covered tetracyclines كان أكثر على gram-negatives بس لهم effect على الكل. حكينا عن aminoglycosides, how they are most usually on the gram-negatives. And then we have now we're covering the macrolides, which mostly work on the gram-positives. فليش كتير مشهور اللي بيسمع عن الزيثروماكس أو هلا كليريثرومايسين، اللي عادة الناس اللي عندهم بنسلين الرجي بيكون هذا المكلان تبعه هو اسمه زيثروماكس، دول استخدم azithromycin. So it's one of the safest antibiotics in use, and it's used in penicillin allergic patients who أكثر أدوية تستخدم على people with penicillin allergy. Because of يعني عادة penicillin work more on gram-positive. This is the gram-positive alternative that does not work on the cell wall. So basically that's your main best one to use. azithromycin, erythromycin, clarithromycin. بجوز سمعتوا عن الازيثرومايسين هلا بيستخدموه. It's showing some effect for people who have COVID. It doesn't seem that it affects the actual virus, or may have small activity, but it prevents superinfection of other bacteria اللي هي mycoplasma. هاي كتير مهمة. And strep pneumo. So that's probably why it has this protective effect with people with COVID. So that's azithromycin, clarithromycin, treatment of Helicobacter. كتير يستخدم Helicobacter. This is part of the triple therapy of Helicobacter اللي بنحكي عنه. This is clarithromycin. And erythromycin we just mentioned عادة for the gram-positives and for penicillin allergic patients. هلا telithromycin is basically يعني the super macrolide. So it's similar to macrolide, but it has a similar mode of action. It's sufficiently different that prevents resistance. يعني الأشياء اللي تكون resistant to macrolides, you can still use telithromycin for them. It has a wide spectrum of activity and can be used for upper respiratory tract infection and community-acquired pneumonia. clindamycin هذا من جزء من الأدوية اللي كتير تستخدم. بيستخدموها ناس بالجراحة كتير، بيستخدموها ناس عندهم anaerobes، وبتستخدم كمان كتير in dental surgery. So it's bacteriostatic, works in the 50S subunit. Its main use is working against Clostridia and bacteroids اللي هم اللي هم anaerobes. So Clostridia, remember, is your main anaerobe. ولكن هم والبacillus are the main clinically important anaerobes. And you have the bacteroids, which are حكينا, they are one of the dominant anaerobes in the body, and especially also in the dental cavity, commonly used for dental infections because of their work on anaerobes. You can still use them for penicillin allergic patient as well. and they work in a similar fashion to macrolides with a different spectrum. فهلا ضفنا macrolides تيريثرومايسين and clindamycin مع بعض هذول، يعني نضيفهم هيك مع بعض. Linezolid أو linezolid, it's a very narrow spectrum anti-gram positive agent. بيحكي لك إنه it prevents the formation of the ribosomal initiation complex. So linezolid, this is something that you can add to your repertoire for MRSA and other gram-positive resistant organisms. فلينزوليد هذا بنضاف مع الفانكومايسين والتيجيسايكلين والسيرترولين، حطوا معهم هذا كمان. There is some evidence that it may be of use in certain drug-resistant TB as well. هلا streptogramins. This is a collective name for a family of antibiotics. اللي هم اللي بيسموهم يعني بتذكرهم كلمة بريستين، the quiniprestin, the dalfopristin. These are the pristins or the streptogramins, and they are suitable for only perinatal, يعني IV administration as only because of their poor solubility. Now the combination between the two has a bactericidal activity against most resistant gram-positive cocci. Not VRE, not Enterococcus, or especially efficace, but MRSA and certain resistant pneumococci. فهلا عندنا الفانكومايسين، هذا ضفنا عليهم السبتوجرامينز اللي يكون بريستين، لينزوليد، تيجيسايكلين، سبتارولين، هذول are main agents against MRSA. amikacin, carbapenems إلى الآن هذول our main thing that we use against gram-negatives, resistant pathogens. فهي وصلناهم macrolides، نيمونيا، مايكوبلازما ليجين اللي حكينا هون، كلاريثرومايسين معهم، الاريثرومايسين، كليندامايسين فور انايروبس، لينزوليد حكينا، دمبايكومايسين ريزيستنت انتيروكوكساي، حكينا سيرفوجرام البريستنز اللي هم فور vancomycin resistant enterococcus faecium, not faecalis, and other forms of MRSA, telithromycin for these resistant ones against the macrolides. So against this, it will work the same thing. Pneumonia. So those are resistant. فهذا بنستخدم لهم telithromycin. So now we covered our drugs that we use against the protein or drugs that we use against that we target the bacterial proteins. هلا some miscellaneous drugs here and there. Mupirocin كثير مهم تحفظوه تعرفوه because this is an antibiotic that is produced by Pseudomonas, one type of Pseudomonas fluorescens, and it can block the incorporation of isoleucine into proteins. فكل البروتينات ما راح يكون فيهم هالامينو اسيد، it will cause the bacteria to not be able to produce proteins. It has great activity against staph and strep, but it is very inactivated systemically. You can't use systemically عشان نستخدمه topical. Mupirocin is what we use to decolonize. هلا نحكي لقدام انه staph وstrep، خاصة staph, the main area where it colonizes the human is in the nose. فاللي واحد بيكون حامل مارسا بدك تدور على المارسا، بتاخذ له تفحص النوز، بتاخذ swab من النوز and you grow it and you see if it's MRSA or not. to decolonize the patient، إنه أشيل هالمارسا منه، بطل هو مريض حامل مارسا، بعطيه topical mupirocin. so topical mupirocin لأنه can be given systemically، فهو زي كأنه cream بحطه بالنوز and around the nose and it will kill the MRSA around and all the staph inclusive including MRSA, which will decolonize that patient. فهلا القصة عنا حكينا tetracyclines work on almost everything but loss of resistant. بعدين حملنا tetracycline chloramphenicol، حكينا has زي كلور بيشتغل for side effects، بنخبي للأشياء اللي بتخوف بالبرين زي المننجايتس والبرين abscess. aminoglycosides ال AG كانت تشتغل على 30S، حكينا هم كتار كبير بيشتغلوا على السودوموناس. and some work on TB, and they work on gram negatives but don't work on gram positives. الماكرولايدز هم بيشتغلوا على الجرام positives، وبعدين طورنا منهم تريثرومايسين، كليندامايسين، انايروبس، لينيزوليد. حكينا these are for the resistant gram positives. معها بتضيف عليه كمان الكريستنز، سيبتوجرامينز، and then fusidic acid amipuricine. هدول هم يستخدموا topical agents for gram positives. هلا نتذكر انه تتراسايكلينز اللي هم دوكسيسايكلين، كوينالوز رح نحكي عنهم، سيبروفلوكساسين، ماكرولايدز، كلاريثرومايسين، امينوجلايكوسايدز، جنتاميسين، glycopeptides, vancomycin, all unrelated to penicillins and are all safe to use in penicillin allergic patients. هدول الأشياء عادة نستخدمهم for patients with allergy to different infections. مثلا يعني whatever gram negative, gram positive here, mix, anaerobe. So you have a lot of options for people with penicillin allergy. So يعني this is just to go back to it and see what we have. So we have covered everything here. We just went through everything. بس نقطة نطلع مع بعض لما خلصنا هاي السلايد. So all the slide is what we just went through for the protein affecting antimicrobials. So you should be able to know everything in this table. هلا راح نبلش نحكي عن those that inhibit nucleic acid synthesis. This will be إن شاء الله المحاضرة القادمة, and with the last or the lecture before last for the محاضرات المد. محاضرات المد راح ينتهوا بعد المحاضرة، في هيك بعد محاضرة الانتي مايكروبيالز تيجي نص محاضرة جست محاضرة تعريفية بالكلينيكال مايكروبكتيريولوجي، لهناك بتكون احنا موقف محاضرات الميد، بعدين نكمل من بعدين بصير محاضرات الفاينل اللي هم كلينيكال bacteriology. And then inshallah we will see you on Saturday for any questions regarding these lectures.